Welcome back to I'm Swanalls. Today, we're talking about one of the most common but often misunderstood health conditions, diabetes. If you or someone you love is affected, stick around to learn about its stages, causes, symptoms, and most importantly, how to manage it effectively. Let's dive in. Number 1. Stages of diabetes. Diabetes doesn't just appear overnight, it progresses in stages. Let's break it down. Stage 1. Insulin resistance, prediabetes. Blood sugar levels are higher than normal but not yet diabetes. No major symptoms, but weight gain and fatigue may occur. Stage 2. Type 2 diabetes onset. Body stops responding properly to insulin, causing high blood sugar. Symptoms start appearing. Stage 3. Chronic diabetes. Uncontrolled sugar levels damage organs, leading to complications. Stage 4. Severe complications. Risk of kidney failure, blindness, nerve damage, and heart disease. Visual cue: show a graph of blood sugar levels increasing over time.
In-depth breakdown of diabetes stages and associated pain. Diabetes is a progressive condition, and understanding its stages is crucial for prevention, early intervention, and effective management. Let's take a detailed look at each stage, how it affects the body, the types of pain associated with it, and what to expect. Stages of diabetes. Stage 1: Insulin resistance, prediabetes. Discovery phase: the early warning pain. Type of pain: subtle, nerve-related, fatigue. At this stage, diabetes is just being discovered, often after experiencing early symptoms like unexplained fatigue, feeling drained even after rest. Frequent urination can disrupt sleep, leading to exhaustion. Extreme thirst, a persistent dry mouth and dehydration. Blurred vision, a strain on the eyes, causing discomfort. Tingling or numbness in hands and feet, early signs of nerve damage, diabetic neuropathy. Headaches and dizziness due to fluctuating blood sugar levels. Emotional pain. Anxiety and fear set in after the diabetes diagnosis. Many feel shocked, guilty, or in denial about lifestyle changes. If you notice any of these symptoms, don't ignore them. Early detection is key to preventing complications. What happens? At this early stage, the body begins to struggle with insulin function. Your pancreas is still producing insulin, but your cells start resisting its effects. This means glucose, sugar, doesn't enter your cells efficiently, causing a slight rise in blood sugar. Fasting blood sugar, 100 to 125 mg dl, pre-diabetic range. A1C, 3-month blood sugar average 5.7 to 6.4%. Symptoms and pain. Often no symptoms or mild discomfort. Possible fatigue, as cells are deprived of glucose for energy. Cravings for sugar and carbs due to poor insulin function. Occasional headaches due to fluctuating blood sugar levels. What to expect? This stage can last for years without noticeable issues, but progression is likely without lifestyle changes. Reversal is possible through diet, exercise, and weight management. Stage 2: Early type 2 diabetes, diagnosed diabetes. What happens? At this point, blood sugar levels consistently exceed the normal range because the body's insulin response is failing. Glucose builds up in the bloodstream instead of entering cells for energy. Fasting blood sugar 126 mg per deciliter or higher. A1C 6.5% or higher. Symptoms and pain. Frequent urination, polyuria, due to the kidneys trying to flush out excess sugar. Excessive thirst, polydipsia, because of dehydration. Blurred vision due to swelling in the eye's lens from high glucose. Tingling and numbness in hands, feet due to early nerve damage, neuropathy. skin infections and slow healing wounds due to weakened immune function. What to expect? If untreated, this stage worsens rapidly, leading to more severe complications. Lifestyle changes and medication, metformin, GLP-1 receptor agonists, can help slow progression. Stage 3 chronic, uncontrolled diabetes. What happens? At this stage, diabetes has progressed significantly with high blood sugar levels that persist for long periods. Insulin function is highly impaired, and the body starts breaking down fat and muscle for energy. Severe insulin resistance or insulin deficiency. Chronic high blood sugar levels damage organs and nerves. Symptoms and pain. Severe fatigue and brain fog. Cells cannot properly absorb glucose. Persistent nerve pain, diabetic neuropathy, burning, stabbing pain in feet, hands. Severe foot pain, swelling and infections due to poor circulation. Loss of sensation, numbness in extremities, increasing risk of unnoticed injuries. Vision loss, eye pain, diabetic retinopathy, damaged blood vessels in the eyes. Sharp pain, vision loss and eye hemorrhages. Chronic infections and ulcers, particularly in feet, leading to gangrene risk. Kidney pain, nephropathy, dull, aching pain in the lower back due to kidney failure. Chest pain, heart disease, increased risk of heart attacks and high blood pressure. Emotional pain. At this stage, diabetics may experience deep depression, feelings of helplessness, and social isolation due to limited mobility or loss of independence. What to expect? Complications are harder to reverse without aggressive intervention. Insulin therapy may be required for management. Stage 4. Severe complications and organ failure, end-stage diabetes, unbearable pain and organ failure. Type of pain. Widespread, inescapable, and terminal pain. At this stage, diabetes has led to multiple organ failures and pain is constant and severe. Severe nerve pain, diabetic polyneuropathy, a full-body burning sensation, like walking on glass or being electrocuted. Intense kidney failure, pain, swelling, high blood pressure, and painful fluid retention. Non-healing ulcers and gangrene, leads to amputations and extreme suffering. Breathing difficulty and heart failure, a crushing feeling in the chest and difficulty breathing. Emotional pain. Many diabetics at this stage struggle with hopelessness, fear of death, and mental distress due to long-term suffering and dependency on caregivers. What happens? At this dangerous stage, uncontrolled diabetes leads to irreversible damage to major organs, increasing mortality risk. Critical organ damage, heart, kidneys, nerves, and eyes. Fasting blood sugar, often above 250 plus mg DL. Ketoacidosis, type 1, or hyperosmolar hyperglycemic state, type 2. Symptoms and pain. Diabetic foot ulcers and infections, non-healing wounds, often requiring amputation. Extreme burning and shooting pain, advanced neuropathy. Kidney failure, diabetic nephropathy, swelling in the legs, severe fatigue. Chest pain and shortness of breath, due to increased risk of heart attacks. Severe dehydration and confusion, from dangerously high blood sugar levels. What to expect? Organ damage may be irreversible without dialysis, kidneys, or other interventions. Severe neuropathy leads to limb loss. Diabetes increases stroke and heart attack risk. So what actually causes diabetes? The answer depends on the type. Type 1 diabetes causes autoimmune reaction, the immune system attacks insulin-producing cells. Genetics, family history increases the risk. Environmental triggers, viral infections may play a role. Type 2 diabetes causes insulin resistance, the body stops responding to insulin properly. Obesity and poor diet, high sugar and processed foods increase risk. Lack of exercise leads to weight gain and insulin resistance. Genetics and age, family history and aging increase risk. Gestational diabetes causes hormonal changes during pregnancy, can make insulin less effective. Excess weight gain increases the risk of developing diabetes during pregnancy. Types of diabetes-related pain and what to expect. Keycap 1 diabetic neuropathy, nerve pain. What it feels like: burning, tingling, or stabbing pain in hands, feet, or legs. Electric shock sensations in nerves. Loss of feeling or numbness, making injuries easy to miss. Why it happens. High blood sugar damages nerves, reducing their ability to send signals. Peripheral neuropathy is most common, affecting hands and feet. Management. Blood sugar control medications, gabapentin, Lyrica, regular foot care to prevent infections. Keycap 2 diabetic retinopathy, eye pain and vision loss. What it feels like: blurred vision and difficulty seeing in dim light. Black spots or floaters in vision. Eye pain or pressure, due to increased fluid buildup. Why it happens. High glucose damages blood vessels in the retina, leading to bleeding and swelling. Management. Regular eye exams. Laser therapy or injections, for severe cases. Keycap 3 musculoskeletal pain, joint and muscle issues. What it feels like. Joint stiffness, especially in fingers and shoulders. Muscle weakness and cramps. Frozen shoulder or carpal tunnel syndrome. Why it happens. Chronic inflammation and glucose buildup affect tendons and joints. Management. Stretching and low-impact exercise, yoga, swimming, pain relief medications and physiotherapy. Keycap 4 diabetic foot pain and ulcers. What it feels like: tingling and numbness, sharp or stabbing pain in the feet. Open sores that don't heal. Why it happens. Poor circulation and nerve damage reduce healing ability. Management. Daily foot checks. Special diabetic footwear. Proper wound care to prevent infection. 2 types of diabetes and causes. Now, let's look at the different types of diabetes and their causes. Type 1 diabetes. Autoimmune disease where the body attacks insulin-producing cells. Cause: genetic and unknown triggers. Type 2 diabetes. Body becomes resistant to insulin. Cause: poor diet, obesity, lack of exercise. Gestational diabetes. Occurs during pregnancy but may go away after childbirth. Other rare types. MODY, maturity onset diabetes of the young. LADA, latent autoimmune diabetes in adults. Visual cue, side-by-side comparison chart of diabetes types. 3. Symptoms and dangers. Recognizing early symptoms is crucial to prevent complications. Symptoms and common warning signs of diabetes: frequent urination, polyuria, excessive thirst, polydipsia, extreme hunger, polyphagia, unexplained weight loss, fatigue and blurry vision, slow wound healing, tingling and numbness in hands and feet. Dangers of uncontrolled diabetes: heart disease, kidney failure, nerve damage, neuropathy, blindness, amputation in severe cases. Visual cue, show an infographic of symptoms and complications. 4. Best diet for diabetes, foods to eat and avoid. Your diet plays a huge role in controlling diabetes. Here's what you need to know. Foods to eat: leafy greens, whole grains, lean proteins, nuts and seeds, low GI fruits. Foods to avoid: sugary drinks, white bread and pasta, processed foods, fried and fatty foods, alcohol. 5. Treatments and management. Managing diabetes isn't just about medication. Lifestyle changes matter too. Medical treatments. Type 1, insulin therapy. Type 2, metformin, GLP-1 receptor agonists. Lifestyle tips. Regular exercise. Stress management, weight control. Visual cue, show an animated step-by-step guide for managing diabetes. Final thoughts, prevention and management. Diabetes is a progressive condition, but early detection and management can prevent severe complications. If you have prediabetes or early diabetes, lifestyle changes can halt progression. Key steps to protect yourself. Maintain a healthy diet, low sugar and processed foods. Exercise regularly to improve insulin sensitivity. Monitor blood sugar levels consistently. Take prescribed medications or insulin. Get regular medical checkups. That's a wrap on today's video. Diabetes is serious, But with the right knowledge, you can take control of your health. If you found this video helpful, make sure to like, share, and subscribe for more health tips. See you next time.